So, distinguished ministers, James, thank you for inviting me up to say something. I think I'm the only signatory of the action plan who's here, so I'm glad to be able to open up and say something about it. I want to start by saying that GAVI was designed originally with partnership in its DNA. This is really important. It was established to be a secretariat for WHO, for UNICEF, for the World Bank, for civil society, for others, with the idea being that by working together, we can do better. Peter Sands, unfortunately, can't be here. He wanted to be here. Mareka's here, but he's also asked me to speak for him. And when the Global Fund was established 2 years later, it also relies on technical partners. So this is something that we strongly believe in. But from our perspective, partnership needs to be with purpose. We don't want to do it just for the sake of doing it. We want to do it to help improve health, to improve efficiency. And so the partnerships that we make include many different groups. We work closely with civil society. We also work closely with industry, but more and more, for example, with the Global Polio Eradication Initiative. We've had 50 additional partners added to GAVI because countries need specific help with different things that our traditional partners aren't there. So this idea of collaboration with purpose is critical to what we're doing. So in terms of when this was originally suggested by Ghana, Norway, and Germany, of course, we welcomed it with open arms. The idea that these groups could come together and try to improve their work, make it more seamless for countries, is something that we absolutely believe in. Of course, GAVI and the Global Fund are very country-specific. We have a country approach. Our job is to try to help countries, and so it is very important to have them be in the driving seat for the type of work we're doing. And of course, at this moment, in trying to implement the SDGs. So how has this worked? Well, of course, we don't work with all 12 of the partners, but as we find areas that we can work together, that's going to be important. But what we have really done is strengthened our partnerships with the different groups where we have alignment and synergy. One particular area we've been working closely with is around the area of accelerating financing, and this is a very important issue. It's about domestic resource mobilization. It's about making sure there's adequate resources. So together with the World Bank, with the Global Fund and GAVI, we've worked on that accelerator, which again is trying to be quite pragmatic. How do we align the funding that comes from different organizations? How can we advocate correctly with countries to make sure that the right funding is going for the right things? How can we make sure there's allocative efficiency? And this is very important because, of course, yes, we have to think about the SDGs, but even in health, primary health care is the critical aspect, and 90% of the essential health interventions can be delivered through primary health care. And yet, as you know, in most countries, the budget is not aligned that way. And so this is very important as we look going forward. So for us, this is really our focus. In terms of moving forward, we will continue to partner with all of the agencies where it makes sense. And I think together we can work to deliver this quite complex but breathtaking vision of the SDGs. Thank you.
Thanks very much, Seth.